Live from our studios in Sikeston, Missouri, it's time for Boot Heel Now. Let's find out what's happening in the Boot Heel now with Brad Zaruba.
And good morning, everyone, on this beautiful Wednesday. Well, I guess unless you're listening on Sunday, but it's going to be beautiful that day as well. Weather might go a little south, though, by the time we hit the weekend. A chance of rain on Saturday, maybe lingering into Sunday, but it's a nice today. We'll be in the 50s, which is still enjoyable for this time of year. My guest today is Sharon Erhan, and she has a guest with her as well, but we're going to let her do the introducing. From Missouri Delta Medical Center, it is always a pleasure to visit with you.
Thank you. Thank you. I love being here.
The new year, I think that has a special meaning everywhere. But at Missouri Delta Medical Center, does the new year bring anything extra other than just good service?
It does. Actually, we've started new services actually throughout 2022, and they'll just continue on in 2023. But what we want to talk about today is Missouri Delta ReBalanace Dizziness Center that we have opened in July. I'm sure everybody has somebody they know that are dizzy or they are dizzy. It's kind of hard to explain what dizziness is, but it's extremely common. And we just happen to have two specialists at Missouri Delta that have come together that we were able to build this center, I guess. I shouldn't say build, create this center for people that have debilitating dizziness.
Well, what I find in particular about dizziness, I think we've all experienced it sometime. I think for many of us, it might happen a couple of times a year. It may just happen once a year or whenever it takes place, but you can't figure it out what it is. And what you have brought to us today, Dr. Zachary Shaw at the Medical Center, is a part of a team, really, that came up with an idea. And then it involved a lot of people, and it came to fruition. Why don't you first introduce him, and then we'll work on how it all came about.
Yeah, actually, I'm very excited to introduce Zach Shaw with me here today. He's a vestibular specialist, which is very rare, and he specializes in the diagnosing of dizziness and find out what's going on. So I'm going to turn it over to him. He's the expert.
Well, why don't you take us back first to how and what you wanted, and that would kind of fit into other things that were taking place at the medical center.
Sure. So, I mean, to start with, I met with Dr. Chance White, who's a vestibular physical therapist. We had just kind of discussed it over dinner one night and then kind of came up with this idea to present to administration so that we could start this. I knew from previous experience in my residencies that this is a big need and that there's not a lot of places in Missouri to do this kind of thing. I actually did my residencies in all of the different places that you can possibly have this type of testing done. So I pretty much knew exactly what we needed to basically diagnose patients correctly and then find the proper treatment for them.
Well, you mentioned that we have the center here, and then there's two in Kansas City.
Correct. Mm-hmm.
And then that's it.
Yes.
What is it, do you think, that has taken so long for this to sort of be something that a need has been recognized and we can work on it?
I think the need has been there for a long time, and I think people do recognize that. I think it's finding the specialist to actually treat it. A lot of people don't know that audiologists are vestibular specialists, and there's not even a lot of audiologists that specialize in vestibular as well. So it's just hard to come by the right providers to be able to get the right diagnosis.
So to make sure all those who are listening to us and aren't used to hearing the word vestibular, help us out on, if you were a layman instead of a doctor, what would you call it?
Yeah, so I mean, vestibular itself just means a portion of the inner ear that has to do with your balance. If there are disorders of that inner ear, it can cause dizziness, vertigo, imbalances, any of those types of symptoms.
Well, Sharon, now you've been there for a long time. You have to be really excited when you start to get these new things that come to the medical center, in particular because, and I've said this before, you are a regional medical center, not just Sikeston Hospital.
Oh, absolutely.
So this is important to add these kinds of services, isn't it?
Absolutely. I love that. This is my favorite thing ever when we have new services. It's just to see the patients benefit from it, and to see people coming from other states to take advantage of this center, because there's just not very many of them. It's very rewarding.
Well, when you start to have this, though, kind of in its infancy, and you said that it's been going on since July, you have to start doing measurements of, well, is this working? Have you been able to see that yet?
Yeah, of course. We've had probably at least 10 patients that we've kind of already seen go through the entire program of, testing and then treatment. And it's made a huge, huge difference in their lives. I mean, people who were, on the verge of it basically being debilitating for them. And now they're essentially back to what they deem as normal.
Well, and I know, we in the public, when we have a particular, I'm going to call it illness just for want of a word, we don't know what we have. We just know how we feel.
Correct.
So if someone is referred to you, and that's the process, what are you trying to look at in the very beginning?
Yeah, so in the very beginning, I basically take a comprehensive case history with them. And that's what's so great about this specific service is that, I get a pretty allotted amount of time with patients because the testing is lengthy. So I get to talk to them throughout the entire process as well as at the start about their symptoms. And right off the bat, we had even talked before this, and just listening to the symptoms, I already have things in my head of what could possibly be going on. And then the testing basically just confirms it for me. And it even diagnoses exactly in the inner ear where this is going on.
Is that something that you almost have to slow down yourself because sometimes you don't really know what it is until you get to the end of that testing? I'm sure there's times where very early on. As the one who's actually doing the testing, how does that actually work for you?
Well, and that's a good point that you kind of brought up because I'm sure that there's a lot of providers just like me who kind of get in their own head, and we kind of at the forefront of the case history, we kind of think we know what's going on to start. And then we soon start to realize when you actually go through the objective testing that we kind of realize that, there's something else going on. Maybe I had an inkling at the beginning, but we wouldn't have been able to find exactly what's going on until we did this testing.
And I would have to think that you're not unique here, but one of the key ingredients about being a medical professional is your ability to listen.
Yes.
And to not get too far ahead.
Yep.
Is that something that in your training and then in your practicing that you've discovered the more you listen, the better you are?
Yep, I think so. Yep, definitely. And I think that with dizziness itself and how long some of these patients can go on, there's a lot of anxiety that gets built up as well. And so I think that that's, at the end of the day, there's a lot of patients that just want to come in and have you listen to what's going on in their lives and what's debilitating for them, what's causing them ailments. And I think that you can form a pretty good relationship with patients, and that's what creates a good treatment in the end.
Again, I know that the somebody's family doctor, most likely, perhaps a different one, is going to do the recommending. What is it that would set somebody apart from just having that routine kind of, I feel a little dizzy, transition to a more serious kind of, I really think you need to see you folks?
Yeah, overall, I would say that anyone who has any type of imbalance, dizziness, or vertigo symptoms, should really think about having this testing done. There's a lot of patients that I have come in, and I think right off the bat, this isn't an inner ear issue. This is something blood pressure related. Maybe they're diabetic, something like that. And then, sure enough, we do the testing, and there's, basically a vestibular damage on one side versus the other that's causing this ailment to begin with. So
this would be one of those things where it definitely seems like there is going to be a significant type of thing that you're experiencing. Dizziness is, you can't hide it. You can't pretend It's not there. It'll go away tomorrow. So some of these things, they just need to have a test.
Yes.
You say that's the bottom line?
Yep. It really is. And that's the thing too, is you can go through, with the normal, medical professionals and everything. And then they might, guess where you need treatment at. But it really just boils down to, until you have this testing done, we don't know 100% what's going on. You could even have an MRI or CT scan. It's not going to show what this testing is going to show.
Okay, let's take our first time out, and when we come back, we'll talk a bit more about this with Dr. Zachary Shaw, and we'll do that in just a minute.
More Boot Heel Now is on the way.
Hey folks, Jared Ritter here with Moreland, Sykeston, Missouri, and it is time for all that winterization of your vehicles. That means all of those things that need to be done for service, bring them in, let us take care of your cars. On top of it, we've got mobile service coming to the area. That means that we're going to be able to come to your doorstep and take care of your needs all winter, new or used. No matter the brand, let us come to your house and take care of your mobile needs on your vehicles with all of your service. Don't forget, if you're looking for a new or pre-owned vehicle, we've also got those for sale. Great deals at Autry Moreland all the time, because if Autry Moreland's not on the back of your car, you paid too much.
It's Boot Heel Now with Brad Zaruba.
And welcome back on this beautiful Wednesday, 9/17, heading toward a very beautiful 50-ish today. I actually show 53 degrees. We'll see if we hit that here on Wednesday. So good to have everybody with us. Sharon Erhan with Missouri Delta Medical Center and Dr. Zachary Shaw are here today. And we're talking about dizziness. And it's something that I think maybe I shouldn't say there are no absolutes, but there's certainly a lot of people who deal with dizziness. Sharon, what is it that you're trying to do in terms of the relationship that you have at the medical center with the actual doctors who are going to be the ones that, for the most part, are going to send their patients to you?
Yeah, actually, the doctors are very excited about it. You know, the second leading cause of why a patient goes to a doctor is dizziness, and a lot of times they're just shooting in the dark. You know, they're not real sure. So this is a great tool for the medical providers to use, to have somebody to send these patients to get testing. You know, and the patient, if they don't send the patient, you know, they're just giving maybe a medication for dizziness or whatever. Yeah, they just speak up and be their own advocate and say, I want to go to this dizziness center I heard about.
You had a passion for this going way back. How did you see that playing out? Did you really have any idea that it would take place here?
Honestly, no, I did not. What's funny enough is my wife was actually a provider here first, and then that's how we ended up even talking about it to begin with. So I didn't really see anybody kind of going on with it. I honestly thought that I was going to kind of start my own private practice eventually, but I was gracious enough to fall in front of Missouri Delta, and they were able to kind of start this up properly. I think there's a lot of people that don't do it correctly, and they kind of went full engine with it. Yep.
But Sharon, isn't that what you like to see at the medical center? You and others, of course, that you have this sort of ingenuity of you like creative people to come to the powers that be, and then to see, can we make this work?
Absolutely. I mean, it was incredible. I mean, they pitched it to us, and as long as it makes sense, and we did have a lot of help from our foundation, which helped purchase some of the expensive equipment for the testing. So that's always helpful. And anything that can help us stand apart is beneficial to the hospital and to the community.
Well, we talk about tool belts and the different tools that you can put in your belt that makes you that regional center. Is that something, though, that from start to end, how long did this take to really get in play?
I mean, really, it only took maybe a few months to kind of get into play. Me and Chance, we had that meeting and then kind of presented it to them, I think, in around maybe February or March. And then within a few months, they were ready to get everything started. We are still technically waiting on a piece of equipment that's taking a little bit longer. But that piece of equipment, can really, really set us apart from anyone else. Yeah.
We haven't really said anything about Dr. White. How the two of you paired with each other, and how do you bounce ideas off one another?
Yeah, no, it's been great. It's obviously been great to have someone that I can talk shop with and who actually understands everything. But in terms of patient care, I mean, it's been immaculate between the two of us. Like I said, without this testing, you're basically just taking a shot in the dark at patient care. And once you know exactly what's going on, me and Chance basically collaborate about almost every single patient. And we're constantly up to date with how that patient is doing and what needs to maybe happen differently in therapy.
We talked about something before we came on relative to the really large medical centers. Mm-hmm. If you want to go to the Mayo Clinic, it's got to be in the top of the size-wise and also the care that they can provide. But oddly enough, you may be able to have better one-on-one in this particular field right here.
Yeah.
Isn't that the case?
I think that with some of the patients that we've seen so far, we have kind of seen that care for them kind of being exposed. We've had several patients that have gone other places for their dizziness, and unfortunately, they just didn't get the help that they needed. They were able to come to us. We got the testing done. Went to Chance. You got the therapy, and those patients are doing great now.
Is there some of that too, Sharon? The fact that we are still a small community here. Some of the people, when they come, they know who Missouri Delta Medical Center is, and you do get, maybe you get a little bit more of that personal care along with everything you do provide as a doctor. You still have, these people are from Sikeston. I really want to make sure I help them. Do you sense that at all at the medical center?
Yeah, I mean, that's one thing that we pride ourselves in, is that you're a person there, not really a number. We really know these people. These people are in our community, and even people that come from outside the community. We want them to have the perception of a friendly local hospital that cares. So that's the goal, our long-term goal.
Okay, let's take our final time out. When we come back, we'll have a few thoughts from Sharon and Dr. Shaw. We'll do that in just a minute.
More Boot Heel Now is next.
Hey folks, Jared Ritter here with Ultramoreland, Sikeston, Missouri, and it is time for all that winterization of your vehicles. That means all of those things that need to be done for service, bring them in, let us take care of your cars. On top of it, we've got mobile service coming to the area. That means that we're going to be able to come to your doorstep and take care of your needs all winter, new or used. No matter the brand, let us come to your house and take care of your mobile needs on your vehicles with all of your service work. Don't forget, if you're looking for a new or pre-owned vehicle, we've also got those for sale. Great deals at Ultramoreland all the time, because if Ultramoreland's not on the back of your car, you paid too much.
Let's join Brad Zaruba for more Boot Heel Now.
And welcome back. Sharon Erhan with Missouri Delta Medical Center, along with Dr. Zachary Shaw, who's also at the center as well, but in a new department. It's good to have both of you here and to learn about some of the things that are auditory. And one of the things that's key is our youth, the kids. And you guys have worked something out to help the kids in Sikeston to have a better shot at perhaps understanding why they may have difficulties in school. So take it away.
Yeah, actually, Dr. Chance White, the physical therapist, vestibular specialist, has always had a passion for the kids too. A lot of vestibular issues are causing kids to not excel in school. Sometimes it's maybe a reading problem. Sometimes they get headaches, and a lot of it can be treated, I guess you'd say, is that they don't have to live with it. So I'll turn that over to Zach a little bit more.
Yeah. So, I mean, in the more medical professional terms, we have things like smooth pursuit, optokinetics, saccades. All those different types of things can cause a child to have issues. In layman's terms, basically, we just call it visual tracking. You're basically reading a page and your eyes kind of bounce around on the page rather than actually understanding everything that's being read. So a lot of kids are struggling with different types of things like that can cause reading issues, understanding issues. We've even seen, a lot of kids that complain of, I can't watch the teacher in front of the room because, they're moving their hands everywhere. Again, a visual tracking issue. So a lot of those things can be tested. We can see what is causing that issue. And then again, therapy to get that back to where it should be.
So when you go into the schools, I guess it would be similar to I remember the eye test. When I was a kid, everybody would come in and have that eye test. Mm-hmm. How does it work in the schools?
Yeah, so we would basically have a screening program, essentially. Me and Dr. White, the vestibular physical therapist at the hospital, will go in and basically personally work with these kids to see if there's any abnormalities that we can see just with the naked eye, and just putting them into different positions. But mainly, again, the testing is what's going to give us the objective measurements. But
so a couple of things, though, I guess. First, it's the youngster, but it's also for the teachers. Mm-hmm. So they, I imagine, have an understanding of what to look for.
Sure.
Would that be true?
Yes, and actually, Chance is DESA certified as DESA, I think that's how you say it, and he can actually do training for teachers to know what to look for in students, to identify students that might need help. So we actually have a lunch and learn with the all the area schools, superintendents and administrators, to let them know we're willing to come in and do these free screenings for them, and then also do the training for the teachers so they can identify.
Well, as someone who was in the schools almost every day, it's important for us to be able to kind of understand the kids that are in there that they may not qualify as special needs kids, but they're on the border.
Well,
And if you recognize certain things.
yeah, and a lot of times they're identified as maybe having behavioral problems and things like that, and it's really they just they can't concentrate or they can't they can't read. They're getting bored because they can't do what they need to be doing in class.
Any final thoughts?
Yeah, I mean, in terms of those kiddos, for sure. In terms of kind of what Sharon was saying, I think that a lot of these kids, basically, they're going home at the end of the day not being able to, have the knowledge that they're supposed to have because they won't be able to focus during the day, things like that. And then again, it's hard for the parents as well as the teachers to kind of identify that. But that's why I think this service is great and why we're trying to get into the schools and do these screenings.
Sharon, on the way out, it's great. So many things at the medical center. Your final thoughts today?
If you think that your child or if you or somebody you love is dizzy and you're not sure what your next step is to call our center. And we can help get you in the right direction of where you should go to get an order, or Chance is really good about doing some screenings to see if they would benefit from the testing. So calling the center would probably be the best thing. And I'm trying to think of the number 472-6034. And go to our website.
That's the best one. Give us the website.
Yeah, MissouriDelta.com, and just look for Vestibular.
Well, again, it's great to have both of you here, Sharon and Erhan. It's always great to visit with you, and always appreciate you visiting with or bringing guests. Dr. Zachary Shaw, it's great to see you and to meet you, and you guys have a good week. And for all those here, Joe Bob, thanks again for keeping us on the air. And everybody at home, I hope you're having a good new year, and we'll see you next week.
You've been listening to Boot Heel Now.